Struggling with swollen ankles and feet? I know this can turn a simple walk into a challenging task. But what if I told you that understanding the root causes could be your first step toward relief? Join me as we unveil the top 10 reasons behind this discomfort. Hit the like button if you're keen to discover how to ease your discomfort, and subscribe for more helpful health insights. Number 1. Trauma. Think of those moments when you've awkwardly twisted your ankle stepping off a curb or stumbled on a loose step. Suddenly, you notice your ankle balloons up, swollen, right? So, when your feet or ankles experience a sudden impact or injury, it's common for them to swell. The swelling happens because your body is rushing fluid and white blood cells to the site to start repairing any damage. Applying a cold compress can soothe the area and reduce inflammation. Afterward, elevating your feet can also help reduce swelling by encouraging fluid to flow away from the injured area. If the swelling persists or is accompanied by severe pain, it's important to consult a healthcare professional to rule out more serious injuries like fractures or sprains. Remember, each cause of swelling requires a tailored approach to ensure proper healing and health. Number 2. Pregnancy-related complications. When you're expecting a baby, it's normal for your feet and ankles to swell up a bit. This happens because your body has more fluid than usual, and the baby can push on blood vessels, which makes it harder for the blood to move. Most of the time, a little swelling is okay, but you should watch it. If the swelling is a lot, or if you get a bad headache, your vision changes, or you feel out of breath, you should tell your doctor right away. These things can be signs of preeclampsia. It's a serious issue that can happen after the 20th week of pregnancy, and can cause high blood pressure and harm organs like your liver and kidneys. Even if you feel okay, keep going to your doctor's appointments. They help make sure everything is going well and catch any problems early. Number 3. Medications. Ever notice your shoes feel tighter after starting a new pill? Medicines can sometimes cause your ankles to swell up. Common ones that might cause this include blood pressure medications like calcium channel blockers, pain relievers such as NSAIDs, anti-inflammatory drugs like corticosteroids, and certain diabetes medications. These drugs can make your body hold onto fluids, leading to swelling. They might affect how your kidneys work, or cause your blood vessels to retain more fluid. If you start a new medication or change your dose and notice swelling, it's a sign to keep an eye on. It's always a good idea to talk to your doctor if you see any swelling. They might adjust your medication or suggest lifestyle changes like eating less salt to help reduce the swelling. Sometimes a different medication might be necessary. Remember, it's also possible that swelling can result from how different medications interact with each other. So, if you're taking multiple drugs and notice swelling, make sure to discuss this with your healthcare provider. Finding value in these tips? If so, a gentle tap on the like button and subscribing to our channel would mean a lot to us. It's a wonderful way to join our community where we share health tips and insights just perfect for enhancing your daily well-being. Number 4. Venous insufficiency. Ever feel like your legs are just too heavy and your ankles look puffy? That might be venous insufficiency. It's when the veins in your legs struggle to send blood back up to your heart. Think of it as a traffic jam in your veins, and it can cause your legs to swell up. This problem is more common as we get older, and it's something women in particular need to watch out for. If your relatives have had trouble with their veins, or if you're on the heavier side, pregnant, or spend a lot of your day sitting or standing, you might be more at risk. Leaving it unchecked can lead to issues like varicose veins, skin color changes, or sores that don't heal well. But there are easy ways to keep it in check. Staying active is key. Move around regularly, especially if you're usually stuck in one spot. And when you're sitting down, try to raise your legs now and then. Those snug socks your doctor mentioned, compression socks, can also be a big help. If you're noticing swelling, pain, or any changes in your legs, it's time to talk to your doctor. They can help you figure out the best way to manage it and keep your legs feeling light and healthy. Number 5. Lifestyle factors. Ever wondered why sitting or standing too long makes your ankles swell? It's because staying in one position can slow down your blood flow, causing swelling. Keep moving and stretch regularly to maintain good circulation. Try elevating your legs above your heart occasionally to help blood flow back properly, and consider wearing compression socks to support this process. Diet also plays a crucial role. Drinking plenty of water and eating potassium and magnesium-rich foods like bananas and spinach can help prevent swelling. Additionally, carrying extra weight puts more strain on your veins and lymphatic system, leading to swollen legs and ankles. Implementing a healthier diet with fruits, vegetables, lean proteins, and whole grains can greatly reduce this strain. Persistent swelling should not be ignored. If it continues, consult your doctor, as it may indicate a more serious condition. Enjoying these valuable tips? We'd love to hear your thoughts in the comments below. And if you believe this information could benefit others, please consider sharing this video. Number 6. Blood clots. Think of a blood clot like a traffic jam in your veins. If one of your legs suddenly starts to swell and it feels sore or looks a bit red or blue, it might be a blood clot blocking the flow. This is super serious because that clot can take a trip to your lungs, causing a really dangerous condition called a pulmonary embolism. If that happens, it's time to see a doctor immediately. To help prevent clots, move around a lot, drink water, and listen to your doctor's advice if you're at risk. Number 7. Heart disease. If you often find your shoes feeling tighter by the end of the day, it's time to listen closely. Your heart could be asking for help. This could be your body's way of saying, your heart needs extra care. In that case, legs and ankles are swollen often, so it's time to have a chat with your doctor. It might hint that your heart isn't as healthy as it could be. But don't worry. There are steps you can take to support your heart. Cutting back on salty foods, staying active, and taking water pills, known as diuretics, can all help if your doctor agrees. For those of us over 50, it's even more important to keep an eye on our heart health. Regular checkups with your doctor can catch any heart issues early on. And if you notice your swelling isn't going down or you're seeing other changes, don't wait. Get in touch with your healthcare provider. In more severe cases, these symptoms could point to a specific heart condition. Heart failure is one such condition where your heart isn't pumping blood around your body as well as it should. And this can cause fluid to build up, especially in your legs and ankles. Number 8. Kidney disease. Kidneys are behind-the-scenes heroes that manage our body's water and salt. So when they're off their game, you might see swelling in your legs, ankles, and feet. But it's not just about swelling. If you're feeling more wiped out than usual, making more bathroom trips, or if your blood pressure's on the rise, your kidneys might be calling for help. Catching kidney issues early can be as simple as a blood or pee in a cup test at your doctor's office. For those of us who've celebrated more than 50 birthdays, it's very important to watch these signs. Keep in mind, certain factors increase your risk of kidney issues. If you have conditions like diabetes, high blood pressure, or a family history of kidney problems, it's especially important to be vigilant. Regular checkups are best for your kidneys. Number 9. Liver disease. Sometimes when your ankles swell up, it could be your liver waving a white flag and asking for a little backup. Think of your liver as a big filter. It cleans your blood and helps make important stuff your body needs. If your liver isn't doing its job right because of a sickness like cirrhosis, you might notice your legs and ankles start to swell up. That's because there's extra fluid hanging around that your liver can't deal with. If you're feeling exhausted, your skin looks yellow, or your ankles are swelling, it's a good idea to tell your doctor. These can be signs that your liver needs a checkup. To keep your liver happy, don't drink too much alcohol, eat healthy foods, and keep a healthy weight. Taking care of your liver now can help you avoid bigger problems later. Number 10. Malnutrition. Have you ever seen your ankles swell when you don't eat right? Believe it or not, the food you eat can help prevent that swelling. Protein is super important because it helps keep fluids where they're supposed to be in your body. To keep swelling under control, it's a good idea to eat foods packed with protein, magnesium, and potassium. Chicken, fish, beans, bananas, avocados, nuts, and leafy greens are all great choices. They're like a power team for your body, helping everything work as it should. Magnesium is the helper that keeps your muscles and nerves in good shape, while potassium is the boss that ensures your cells do their job right. And protein? It's like the security guard that stops fluids from escaping your blood vessels and causing a traffic jam in your legs. If you're experiencing persistent swelling, it's not something to overlook. Reaching out to a healthcare provider can make a significant difference, providing you with the right guidance and treatment tailored to your needs. If you found value in our video, like this video, share your feedback in the comments, and don't forget to subscribe to the channel for more informative content.